Hello everyone, my name is Sinduja. I finished my Bachelor of Optometry in SRM Institute of Science and Management. Now I am doing my fellowship on Strabismus Management in Indian Academy of Optometry. In this video, I will be demonstrating about the identification of squint based on direction of deviation, based on competency, based on corneal reflex test and cover test. So, what is strabismus? It is a misalignment of the eye or inability of one eye to attain binocular vision because of the imbalance of the muscle. So, in this first thing, we are going to see based on the direction of deviation. So, in this we have two things, horizontal and vertical deviation. In horizontal deviation, we have two, ESO and EXO. In ESO, the eye turns towards inside, and in EXO, the eye turns towards outside. And in vertical deviation, we have two, hyper and hypo. Hyper deviation, the eye turns towards upside, and in hypo, the eye turns towards the downwards. In this image, the first one, the both eyes are aligned together, so it is ortho. And the second one, the right eye turns inwards, so it is called esotropia. And in the third image, the eye turns towards outside, so it is called exotropia. In this, the eye turns towards the downside, so it's called hypo, and in this the eye turns towards the upwards, it is called hypertropia. So second is based on competency. In this it's divided into two, concomitant squint and incomitant squint. In concomitant squint, the angle of deviation is same in all the direction of gazes, and in incomitant squint, the direction of deviation is different in all the cases. This is due to the complete or partial palsy of one of the nerve which supplies the extraocular muscle. So this can be measured using the broad hedge test. So in this we'll be asking the patient to sit straight, and with the help of torchlight we'll be measuring the direction of gaze. First we start with primary, then dextroversion, then dextro elevation, dextro depression, levoversion, levo elevation, levo depression, and elevation and depression. So in the first image, it's an example of the concomitant squint, and the second image, it is incomitant squint example. So now we'll be doing the broad hedge test. So we'll be asking the patient to look straight, and with the help of torchlight, we'll be moving it in different gazes to check the amount of deviation, like overaction or underaction of the muscle. So the third one is based on the corneal reflex. So this will be measuring using the Hirschberg test. So we'll be asking the patient to sit 2 feet apart. With the help of torchlight, we'll be measuring it. Suppose if the patient has a normal alignment, the corneal reflex is seen in the center of pupil. That is, it will be same in both the pupils. If there is any misalignment, in the deviating eye, the corneal reflex will be asymmetric or misaligned or off-centered. In this image, you can see the corneal reflex is same, it's equal, so there's no strabismus. And in this, the left eye, the reflection is seen towards the temporal side, so it is esotropia. And in this, it's seen towards the nasal side, it is exotropia. Here it is seen towards the downwards, so it is hypertropia, and here it is upwards, so it is hypotropia. So in Hirschberg test, we'll be asking the patient to sit straight, and based on the corneal reflex, we'll be measuring the deviation. So last one is the cover test. So it is a gold standard for checking objectively. So it determines the presence, type and magnitude of the ocular alignment. So in this, we'll be measuring for both distance and near. For distance, we'll be giving the target at 6 meters, and for near, we'll be giving the target at 33 centimeter. In this, we have three types: direct, cover and uncover, and alternate cover test. In direct cover test, we'll be measuring the manifest squint. So we'll be asking the patient to look at the target, and we'll be occluding one eye. Suppose if I'm occluding one eye, and we'll be seeing the deviation is present or not in the unoccluded eye. Suppose if the deviation is not present in the eye which is not occluded, then the tropia is not present. Suppose if there's any deviation present in the uncovered eye, then the tropia is present. The second one is the cover and uncovered test. It is basically to assess the phoria. So we'll be occluding one eye. Suppose if the phoria is present, the uncovered eye does not move. However, the eye that is behind the occluder will deviate and return to the state position when the occluder is removed. Alternative cover test. The alternative cover test is generally performed after the cover test. The alternative cover test is the most dissociated cover test and measures the total deviation, which includes the tropia plus the foria. So while performing this alternative cover test, it is important to hold the occluder over each eye for at least few seconds to allow the non-occluded eye enough time to pick up a fixation. In general, the faster the eyes are able to recover when the occluder is switched, the better the control of deviation. Now we'll be asking the patient to sit straight, and the patient should cooperate very much while doing the test. So first, at 6 centimeter, we'll be asking the patient to fixate at a target, and then the cover and uncover test is done, and then the alternating cover test is done for the distance. The same procedure is repeated for the near. So at 33 centimeter, we ask the patient to fixate at the target, and then we'll be doing the cover and uncover, and then the alternative cover test to check any deviation is present.